So now I'm very happy to, very pleased to welcome our second keynote, and that's Associate Professor Byron Powell. And Byron is from the United States, and it's very early in the United States at this stage, at least too early to be, I would say, very awake. He is joining our conference, he is awake, and he is here, but we took the let's say, the stable opportunity to have a lecture on video, and after that we'll have interactions with Byron in also the panel discussion and later on. But just to introduce Byron, Byron is an assistant professor at Brown School and School of Medicine at Washington University in St. Louis. And he's also serving as co-director of the Center for Mental Health Services Research there. And interestingly, at least from my perspective, he is renowned, I think, and doing high-level research in the United States on key topics of implementation science related to barriers, but also, and interestingly, moving towards, let's say, the more empirical and causal relation between barriers and strategies, and also the relevance of tailoring in that respect. So very interesting work that parallels, I think, that the things that we've been doing here, and I'm very looking forward to his insights in this realm. Interestingly as well is Byron is president of the Society for Implementation Research and Collaboration, and I think if you want to are interested in methodological advancements and theoretical advancements, that's really a very interesting society to look for. And again, because it's very early in the morning in the United States, we will play a video of Byron's keynote. He is online, and we will cross to him after his keynote. Welcome to Byron, and his keynote is on the topic of opportunities to improve mental health services through adaptive and tailored approaches to implementation. Over to you, Byron.
Good morning, everyone. My name is Byron Powell, and it's a pleasure to be with you today to share some of our work on improving mental health services through adaptive and tailored approaches to implementation. And I just want to begin by saying thank you so much to the Implemental team for the invitation. Really, it's an honor, and I'm excited to learn about the findings of the study and all of the ways in which you're really pushing methods for tailoring implementation strategies forward. So thank you. It's really exciting to be here. Just want to start by acknowledging that there's a growing body of evidence for a range of interventions. Sometimes we refer to these as the 7 Ps: programs, practices, principles, procedures, products, pills, and policies. But the bottom line is that we know that these interventions are often difficult to implement as we'd hope to improve health and social care. And that's largely because we face barriers to implementation or determinants at multiple levels and multiple phases of implementation. And these challenges persist. We know that over time, barriers emerge at the exploration, preparation, implementation, sustainment, and scale-up phase, and that we see barriers related to things like the organizational context, the political and social context, and so forth. And admittedly, I know that this notion of context is incredibly complex and will be covered by Dr. May in more detail at this conference. So I'm grateful for that. Ideally, our implementation strategies would be responsive to this context, in that the implementation challenges or barriers that we identify would be well addressed by implementation strategies. So just to give 2 examples, if we have something like a provider skill deficit, it may be that training in the form of teaching and practice with corrective feedback would be an effective implementation strategy, working through the mechanism of skill acquisition, refinement, and mastery, hopefully to change the implementation outcome of fidelity to an evidence-based practice. If we have a challenge such as turnover of clinicians or supervisors or others in an organization, it may be that train-the-trainer approaches that allow for continuous on-site expertise to be available for consultation in the EBP would promote the implementation outcome of sustainability. Unfortunately, we know from the literature that oftentimes implementation strategies are not well matched to context. In fact, there are a number of potential pitfalls in designing, selecting, and tailoring implementation strategies that prevent that. One of the strategies, or the approaches that we use too often, is the train and pray approach, right? We send people to training, we hope that their behavior changes, but in reality, we know that that's usually necessary but not sufficient. Another approach that's common is what we might think of as the kitchen sink approach. We try a lot of different things with the idea that more is better, but we know that from the literature and certainly meta-analyses that sometimes multifaceted approaches are not as effective as single component or simpler strategies. This might be because our multifaceted approaches are not addressing identified determinants in various settings, or it may be that we use a multifaceted approach that really addresses only one level, such as the provider level or knowledge and attitudes, while failing to address organizational and systemic issues. Certainly, this conference is all about tailoring approaches. One argument is that we too often use one-size-fits-all approaches, and that we need more tailored and adaptive approaches to address varying contexts with vastly different needs. And finally, Martin Eccles used to suggest that we use the Islagiat principle, or it seemed like a good idea at the time, as we're really trying our best in implementation, but not necessarily with full information about the types of theories or evidence that might be suggestive of the types of approaches we may need. Ultimately, Vensing and Grohl really underscore that this leads to a situation in which there's often little association between the type of problems that we're facing and the approach to change taken. And they also note that organizational and system-related problems tend to be ignored, even if they're detected, in favor of individual educational or psychological approaches. So we have a long way to go to more effectively tailor implementation strategies and ensure that organizational, systemic, and other ecological levels are addressed in our implementation work. And I certainly applaud the Implemental team for taking this on in a really ambitious and rigorous project. And so eager to learn more about the results and, again, the methodological innovations herein. And I'm sort of organizing this talk around these 4 steps from the Implemental model, starting with the systematic identification of local barriers to successful implementation. And I want to suggest just quickly 4 ways in which we might improve our assessments of context and then specifically implementation determinants. One of those ways is something that Implemental team actually took on. This systematic review by Christian and colleagues is one way of suggesting that though we have a number of primary studies of implementation barriers, a first step might be actually to synthesize those studies and to learn across studies within a given area, what are the common barriers and facilitators that have been identified. We've taken a similar approach within children's mental health, and specifically related to trauma-focused interventions for children and youth. And we found this to be very helpful context and a very useful first step in informing an implementation approach. And so rather than starting from scratch, systematic reviews of implementation determinants can be a very useful first step. Certainly there's room for quantitatively assessing implementation determinants. And one of the ways in which we can improve this area is really pushing the field towards the development of psychometrically strong and pragmatic measures. One of the things that we know is that oftentimes our measures are too expensive, they're too lengthy, they're not practical to be used by folks in the community. And so Kara Lewis and colleagues have really been leading the way in assessing the the pragmatic and psychometric properties of measures in the field. How can we actually rate them? How can we develop more pragmatic measures over time and use those to get quicker feedback on things like implementation determinants, implementation outcomes, and other implementation related factors. And I have a link down here to Implementation Research and Practice, which is a new journal where many systematic reviews of implementation related constructs are being published. Certainly, in addition to quantitative measures, we've often found that qualitative work, whether it's informal consultation with stakeholders or formal qualitative methods such as semi-structured interviews or other ethnographic approaches, can be very useful in understanding the nuances and really getting a depth of understanding of implementation context and implementation determinants. There's some useful guidance here from the National Cancer Institute, as well as a recent scoping review that we conducted on ethnographic approaches to implementation. And many of those studies, I think 88%, focused on understanding implementation determinants. So I urge you to look there more. And then finally, just one thing that we could use more of is system science methods. And so one of the critiques is that we often generate these lists of determinants or barriers for facilitators. We don't necessarily understand how to prioritize them, how they relate to one another, or sort of the complexities therein. And system science methods such as system dynamics approaches or group model building approaches, or things like social network analysis that can help us to understand the complexities of context, and again, the sort of the interrelation between different barriers and facilitators could be quite helpful. So it's nice to see more and more of that work, but I think that we need more and more of that to understand how we can sort of best identify leverage points for implementation in the field. So moving on to the next portion of this model, selection and matching of implementation strategies from repositories of implementation strategies. And I just wanted to mention briefly, so we've done some work to develop the expert recommendation for implementing change, or ERIC compilation. And there's also been some work to extend that in various ways. Here are just a few of those examples, extending that work in school mental health, extending it to financial strategies, and extending it appropriate for this conference into digital mental health interventions. And the idea here is that we really wanted to just name and define implementation strategies, hopefully in a way to promote a common understanding of strategies, promote a common language in the field, but also just to be suggestive of building blocks of multifaceted, multi-level implementation strategies that folks could use to really tailor approaches to their given settings. So that's the spirit of this. But one of the things that I wanted to emphasize is that these are really just starting points. And there's tremendous room to extend these approaches, to suggest what's not useful, and to make these approaches more useful. So I certainly hope that within this project and folks that are at this conference will think of ways to advance this work. We're certainly trying to push on this ourselves in our work, and the first couple of bullets here are really suggestive of the fact that many of the strategies listed in these compilations are really quite broad and generic. And in some cases, they need to be fleshed out. And the first example I want to mention is Sheena McHugh, who is on faculty at the University College Cork in Ireland, who is really leading some work to link the ERIC implementation strategies with behavior change techniques as defined by Susan Mickey and her colleagues. And this is a way of really sort of fleshing out the implementation strategies with the more granular behavior change techniques. And I think also is shedding light on potentially how and why these implementation strategies work. Similarly, we have some work that we hope will be funded by the National Cancer Institute, as well as some work that's already funded through the Agency for Healthcare Research and Quality, led by Kara Lewis and Brian Weiner, in which we are really trying to identify mechanisms through which the ERIC implementation strategies operate. There are a number of other opportunities to improve these compilations. Just a couple more are, how do these strategies actually pertain to things like sustainment and de-implementation? What are the similarities and differences there? And finally, importantly, how are these strategies leveraged to address issues related to racial justice and health equity? And are there strategies that need to be added to these compilations in order to address those important issues more thoroughly? So moving on to the adaptation of strategies and really context-sensitive tailoring of implementation strategies. So once we've identified potentially useful strategies from compilations or other sources, how do we ensure that they're effectively tailored to settings? And the first thing that I want to suggest is that there's tremendous opportunity to identify, develop, and refine better methods for linking determinants and strategies. And I think this is certainly something that's been emphasized in the Tailoring for Interventions for Chronic Disease study, as well as the Cochrane review by Baker and colleagues back in 2015. We've worked to identify some potential methods for this, including intervention mapping, group model building, and conjoint analysis, for instance. And Heather Cahoon and her colleagues have also identified 15 different replicable methods for designing implementation strategies. And echoing Vensing and Grohl, one of the things that Heather and her colleagues found was that there's really a limited focus on organizations and systems in this work. And we've tried to address this in one way by developing a matching tool that matches a well-known framework for identifying implementation determinants, which is the Consolidated Framework for Implementation Research, with the ERIC implementation strategies. And so we've developed a Excel-based tool where you could suggest which of the 39 implementation constructs within the CFIR would you like to address, and the web-based tool or the Excel-based tool will suggest specific strategies that you might consider. So for instance, in this case, if you had low reflecting and evaluating, so little to no feedback on progress and quality of implementation, you might use strategies such as developing and implementing tools for quality monitoring, audit and feedback, clinician implementation team meetings, or capturing and sharing local knowledge in various ways. So hopefully these will be perceived as sensible strategies to address that barrier. And the idea here is that you could use this as a starting point to identify potentially relevant strategies, and then obviously you would need to operationalize them for your specific setting that you're working with and to address the needs therein. But this would be a nice starting point by which you could launch a further tailored implementation strategy and ultimately an implementation plan that operationalizes that in detail. Another approach to advancing methods here that we've been taking is to leverage intervention mapping to design and tailor implementation strategies. Many of you might be familiar with intervention mapping as it's been applied in public health. It's long integrated implementation related issues, but Maria Fernandez and her colleagues are really working to push this forward and further integrate implementation science. And similarly, we've been trying to apply and pilot and test an intervention mapping approach in NIH-funded studies here in the US and in Vietnam. In this study in the upper right-hand corner, we've used this systematic approach to developing implementation strategies with at the organizational level. So really working to coach organizations and really co-create implementation strategies with organizations using these tasks. So beginning with a needs assessment, and then really identifying the adoption and implementation outcomes that need to be addressed, the performance objectives, which is really who needs to change what in order to implement and sustain the intervention, what are the determinants that get in the way of those things, and then selecting implementation strategies that are likely to address those, and ultimately developing implementation plans and evaluating implementation outcomes. This is just another similar approach, I think, to Implemental that could be complementary. I think many of these approaches will seem very similar to what you're trying to accomplish in the Implemental study. Another approach to enhancing tailoring would be really to optimize strategies that are inherently adaptive already. So something like facilitation, which is really a process of interactive problem solving and support that occurs in the context of a recognized need for improvement and a supportive interpersonal relationship. Facilitation has been described as a meta strategy in which, external facilitators are really leveraging a lot of different strategies and coaching organizations and teams to really tailor strategies to their specific setting. And in that way, strategies like this are already sort of inherently adaptive and supposed to be, well suited to the context that they're operating in. And I think advancing strategies like this, but being more and more clear about what it is that facilitation entails, what do good facilitators do, what specific methods can they use to align determinants and strategies more effectively, and so on and so forth, is a way of really advancing the field in this area. Another approach would be to develop and test adaptive strategies formally through things like sequential multiple assignment randomized trials, or SMART designs. And this is the notion that we might take two different organizations. One might be quite responsive to a lower intensity strategy. So they may respond, for instance, to being in trainings and a learning collaborative, and that might lead to implementation success for that agency. But other agencies may need more support in a variety of ways. And so we might actually randomize organizations that don't initially implement things well to a more supportive condition that involves more intensive implementation strategies. And ultimately, if we develop these types of adaptive strategies, this might be a way of using resources well, so that organizations that need less support receive the support that they need, whereas organizations that need quite a bit more support can be attended to appropriately. And finally, this is a bit aspirational, but we think there may be opportunities to move towards a more common elements approach. And I thank Thomas Engel for this slide, which I think really nicely illustrates that across implementation approaches, just like across our clinical and public health interventions, there are a lot of commonalities. We have this problem called pseudo-innovation in our field, where we come up with new names for things, but oftentimes we use very similar elements. And I think as evidence in the field accumulates, we will have a lot of opportunities to identify what are the common elements across these different implementation strategies, and how could they be used in a more adaptive or modular fashion moving forward. So for instance, we may identify a host of strategies that are effective in improving implementation leadership, or organizational culture and climate, or clinician knowledge, et cetera. And then we may be able to apply those strategies in a much more flexible way, rather than adhering to rigid or manualized implementation approaches. And finally, I won't spend much time on this because I know I'm running out of time, this notion of context-dependent application and evaluation of strategies. There's obviously a ton of work on this. One of the papers that we've written suggests 5 different ways of enhancing the impact of implementation strategies. And I just want to emphasize 3 of these. We've talked a lot about the first one already today. But we think there are a lot of opportunities, again, to specify and test mechanisms of change in implementation, and also to improve how well we track implementation strategies, in particular particularly in a tailored implementation environment. What are the specific strategies that are being used? How are they being operationalized? And how will we actually learn from them moving forward? This requires us to really carefully document those strategies and to report them in the literature in a way that is going to be replicable in research and practice. And certainly we need far more effectiveness research in the field. And again, I would urge you to take a look at this paper if you're interested in reading more. And sorry, I can't speak more about this at the moment. And finally, just want to suggest this is a great paper by Luke Wolfenden and colleagues, where we tried to lay out some suggestions for researchers who are undertaking randomized implementation trials. But I also think this is a really nice introduction to implementation generally, and particularly in really laying out the difference between clinical efficacy and effectiveness research and implementation science. And so please take a look if you're interested, and happy to talk more offline about this or any of these topics. I will try to be awake and alert for the conference, though it's quite early my time. I think it starts at 3 a.m. So I will be there, and probably full of coffee or Diet Coke, but also would suggest that I'd be happy to talk to any of you if you'd like to reach out to chat offline. Thank you again for this opportunity. I really appreciate it. And again, just very much looking forward to learning about how the Implemental project is advancing this field. And I think, again, probably emphasizing many of these areas that I stressed today.
Thanks, Byron, for this very inspiring talk. It's a very comprehensive overview of a whole lot of research relevant to the field. And as you perfectly explained, that well, developing an intervention that tries to combine all these aspects into one is not nothing. And I'm very thankful for the overview that you gave and all the insights that are in there, also as a starting point to further pursue research. I've just one question also to you, in the sense to, well, not only to show that you're alive and you're in here, that's one thing, but the other thing is really so. And we'll talk about that much more throughout the conference, I think. But the approach that we took in developing the It Fits toolkit is really the focus on flexibility, and the flexibility in terms of allowing implementers and stakeholders in the settings in which they operate to define and determine what is necessary, whilst at the same time giving all kinds of information and structure, etc., to come to a strategy, basically. How do you see the and perhaps it's also something for the discussion panel later, but how do you see the relation to expert-driven tailoring or expert-driven implementation versus a more well, the flexible way that we took in that sense?
Yeah, admittedly, I much admire the more flexible approach. I think Carl May outlined sort of the complexities of context and the need for that type of approach very well in his talk. And in some of the work that we're doing with intervention mapping, I think that's precisely the approach, is sort of really letting the organizations drive decisions about what types of implementation strategies they use, and letting that be responsive to their context. And in fact, oftentimes we've found that, those strategies are not necessarily closely aligned with, the types of strategies we even outline in the ERIC compilation. And so many of them are much more organic and practical in nature. And I think that that's a beautiful thing. So I applaud the more flexible approach. And I think in general, I'm predisposed to appreciate generalizable processes like this that we can replicate rather than sort of rigid approaches to implementation.
Yeah, I think that's so. Thanks for your comment in that sense. And I think it's a debate that we have, at least in Europe, but I think it's also in the United States on implementation science, the relevance or the thought of implementation practitioner as an expert and trying to drive the implementation in that sense, infusing the processes with knowledge, but also facilitating that. So more to come, I think, in that respect to, let's say, expert-driven versus indeed generalizability and flexibility in that sense. Thanks very much, Byron, for your talk, and we'll have a good discussion later also. Thanks.